Hi, this is Jessica from Guidewell. I'm here at Exponential Medicine, and standing with me is Michael from X2AI. X2AI just received the MEDy award for convergence last night, and so we're going to find out a little bit more about the company, their innovative technology, and we'll hear how excited Michael is to be named winner. So Michael, first off, tell us a little bit about X2AI. I know you're one of the Singularity University accelerator companies. Tell us about the company.
Sure. So we're using an emotional artificial intelligence to hold conversations with patients in order to support therapists with their treatment.
Okay, so what exactly does that mean?
It basically, you can imagine it as a phone number. We always say she's just a text message away.
Mm-hmm.
So it seems like a virtual personality, and you can text her if there's something up, and then discuss your problems, and she'll make sure that you'll feel better.
Okay, so if something's bothering me, I can just text her. You
Yes.
keep calling her, so she's got a name.
In this case, yes. Right now, the name is Tess,
Okay.
which comes from our academic research.
Okay.
But it's also a female name, so now we refer to her
Refer
as
to her
she.
Tess. Okay,
Yeah.
got it. So I can text, and she'll respond to me with an appropriate response.
Yes, indeed.
Okay.
Yeah.
And so, how does she know what to say?
Cool. So we've been doing over 8 years of research in psychology and machine learning.
Okay.
So now we've created emotion algorithms. So we're able to sense how a person is feeling and also determine how to respond accordingly to really be on the same wavelength and start forming an emotional bond.
Okay, so did you just say that you've reduced our emotions down to an algorithm? Is that what you just said?
We found a way how machines and artificial intelligence can actually be emotional and really work together with people in the right way.
Okay, so can I make her angry?
You could try,
And?
if it's useful, then she will get angry.
Oh.
And it just depends on which situation you're at. Like sometimes it's good to find someone on the same level, so not someone who's super happy and excited about everything.
Right.
Although you're really sad, then it doesn't really help if someone tries to make you feel better. So sometimes it's good to be on the same level. So yes, she will adapt to that.
Okay, so how is your company planning on using this? Like, what's the application for this? What are some of the ways that this is going to be integrated into healthcare?
Yeah, so right now we're doing a pilot with a large mental health clinic, and there we're assisting them in internet-based therapy for people with minor depression. And there, Tess really acts as a coach. So normally the therapist would pick up the phone and sometimes call the patient and ask them how they're doing, how the course is going,
Sure.
and just being there for them. And now Tess will be doing that.
Okay. So she's effectively taking over the role of, not the therapist, but she's acting as almost a friend and a guide. to
Yes,
the patient.
indeed.
Okay,
Yeah.
excellent.
Yeah,
Okay.
and she remembers everything that goes on in their lives, and also especially what helps them to feel better. So someone might feel really bad because they're really stressed,
Okay.
and they might see the world in a really negative way. But then she could advise them like, hey, why don't you just go for a run? And then she will remember if this worked or not, so that the feedback loop is
Wow.
really short, so that the patient truly finds their own coping mechanisms with situations, so that they become more independent. And that's really what we want.
In addition to remembering the coping mechanisms that worked, will she also remember the details of what has been told to her?
Yes, of
So, like,
course.
if I broke up with my boyfriend and I texted this to her, she'd remember?
Yes, indeed.
So I don't
And-
have to go through all the painful details every single time?
No,
Fantastic.
indeed, no. She'll remember and she'll
Wow.
follow up with it and ask like, hey, how's it going now? And also make sure she doesn't bring it up every single time.
Right.
Yeah.
Wow, okay. So what other applications for this have you guys explored, or are you
Yeah, of
considering
course.
exploring?
Yeah, we'll be starting a pilot soon for helping patients with diabetes
Sure.
and to lift their psychological barriers to therapy adherence.
For example, what does that
For
sound
example, so they often need to take insulin.
Okay.
And then if you're in a social situation that might become awkward because you have to walk off, but maybe it's really important for your job, so you don't want to walk off, and then there's just these frustrations that come into play. Then they might end up in the hospital because they didn't take their medication on time. And then maybe their family gets angry at them for not taking care of themselves.
Okay, so
these are problems we then can discuss and make them feel better about it and rationalize for themselves, like, oh, maybe if I look at it from a different perspective, my family just really cares about me and they're not actually mad, but they just want to be there for me, but I just have to look at it in a different way.
Okay. So now that you've won the MEDy award, what's next for you guys?
Yeah, so we've been talking to the largest healthcare players in the United States, large insurance companies, large hospitals,
Sure.
and we're trying to figure out how we can work together with them to really scale it up. Because the system is really scalable, so we can help a lot of people,
Definitely.
especially also in remote locations, because she's available on SMS, so she can just be texted from any cell phone.
Okay.
So that's really how we're moving forward now, and this award is just a recognition of our work and that we're really doing a good job. And also for the people at this conference, it's executives from over the entire country and over the entire world. So after the award, people have been coming to me like,
Yeah.
"Oh wow, it's such a great story.
It is
I
a
see
great
how
story.
this, yeah, right, and I see how this solution could really help and benefit us."
Yes.
And that's what we really want. In the end, we want to help the big players to get access to large amounts of patients to really help the patient.
Excellent. Well, good luck. It sounds like you guys have an amazing technology. Congratulations again on winning the MEDy Award.
Thank you so much.
Great. Thank you so much.